Hello, it's a pleasure to share with you today a talk around the patient and his role as actor in research. These are my disclosures. We're all very familiar with the notion of patient-centered care and, of course, of shared decision-making. But what we're going to discuss today is really something quite different, is what is the role of the patient outside of patient-centered care and specifically in research. When we think about a role in research, I want to refer to this participation ladder, which says that there are 4 different roles that someone can have as consultation, advice, collaboration, which will be the main role of interest for us here as patient research partners, and control. And if we apply this to patients in research, then we can, for example, think of patients participating in qualitative research, for example, in focus groups, that would be consultation. Patients participating in priority setting, for example, through advice as Delphi participants. And patients participating fully and collaborating in research, that's what we call patient research partners. And finally, sometimes patients can really control a research project, for example, being part of a steering group for a research project. So let's concentrate on level 3, which is collaboration in research, and that's what patient research partners are. This is the international definition of what a patient research partner is. It's a person who has to have the disease. The patient has to be a patient, so he has to have the relevant disease, relevant for the given project, and then who will be a research partner, meaning who will operate as an active research team member. And what's very important is that the patient research partner has to be on an equal basis with the professional researchers. The patient research partner will add the benefit of their own experience with the disease, and the definition says it should be at any phase of a research project. So I want to discuss with you briefly these 4 aspects: the structures of the patient actor in research, the different levels, some recommendations which can help a researcher to involve a patient as a research partner, and briefly the facilitators and barriers. In terms of structures and structural help to involve patients in research, firstly, we should state that both the FDA and at the European level, the EMA support the patient as an actor in the development of drugs and also the implementation of drugs and the authorization of drugs for a given disease. And if we think about institutes which support patient research partners, in the US, I would like to discuss the PCORI, the Patient-Centered Outcomes Research Institute, which was set up with a consequent funding by President Obama. And this institute really wants to have patients involved in priority setting, but also in the participation in research projects. And in Europe, we have something a bit different called EUPATI, which is European Patient Academy on Therapeutic Innovation, which really puts forward the role of patients for therapeutic development and therapeutic authorization. In rheumatology, in terms of international instances, we have 2 which are really putting forward the role of the patient, and these are OMERACT and EULAR. OMERACT is an international organization around methodology and outcomes, and they have been involving patients for 20 years now, and over the past 10 years, they have developed many ways to help patients be involved in research projects, and I'll be discussing this a bit later on. And EULAR, which is the European League Against Rheumatism, is very advanced as well, with a patient research partnership network of around 60 patients and the development of, again, recommendations and practical ways to help researchers involve patients in research. In some countries also, things have moved forward a lot. For example, in the UK, patients are involved in most of the research projects, and they're also involved in choosing who will get funding for nationwide projects. And in France, we have some involvement of patients, for example, in rare disease networks. There are different levels for which a patient can be involved in a patient research project, and there are also different types of projects that patients can be involved in. If we think about qualitative research, then of course patients wouldn't be involved quite naturally, and there's no issue there. If we're discussing things around patient priorities and patient-reported outcomes research, which means how to develop questionnaires, Again, it makes quite a lot of sense to involve patient, and that's where indeed we have the most experience in terms of patient research partners. In the first step, which is to find patient priorities, patients are always involved. But in the second step, which is quantitative around assessing the psychometric properties of a score, then it's a bit more difficult to find a role for the patient. But usually patients are also involved, at least in the face-to-face meetings. If we move beyond PROs and, for example, look at fundamental basic science or translational projects, then it is indeed more difficult to find the role for the patient. But I think there is a role in the priority setting, sometimes in finding funding, which can be helpful if you have patients involved in the project, and also for the dissemination of the fundings. Now, if we look at the different phases of a project, patients can be involved almost throughout the project. They can help for the priority setting, the identification of project and the priority setting of the research questions. They can help to develop the research agenda. Usually the research design and the carrying out of research is centered around the researchers, not the patients. But patients can play a role in the analysis of the findings and determining if the findings have clinical relevance, and they can help for the dissemination and the implementation of the results as well. Let's look at an example from a patient-reported outcome development, which was a questionnaire we developed within EULAR. And patients were participating almost throughout the project. They helped us for the identification of domains of health through 10 research partners. These patients were more helping at a consultative level than the patient research partners. Again, were very helpful for the elaboration of the questions. Then we ran the validation studies, but the patients were present both at the first meeting and the last meeting. We had 10 patient research partners present. So we can summarize it this way. More than 1,000 patients were there in a consultative role, but we had 65 patients who were there for advice, 10 patients who were really research partners, and 2 patients who were also helping us to lead the project throughout. This is a second example for developing a core set of what has to be assessed in psoriatic arthritis. And in this OMERACT and GRAPPA project, there were really different levels. We had almost 100 patients involved in a consultative role, but also almost 20 patients who were involved really as patient research partners. And then they participate in different phases of the project. So if you want to involve patients in your projects, you should refer to international recommendations. The most recent ones are the OMERACT recommendations, but EULAR has also developed recommendations published in 2012, as well as really practical elements such as these involvement cards. The blue one is for the physician or researcher who wants to involve patients, and the gray one is for patients who want to participate in a project. I invite you to go to the EULAR website if you want to see these practical elements. But OMERACT has developed quite recently in 2016 these 8 recommendations, and you will see that the first recommendations are around how many patients should be involved and how to choose these patients and how to make sure the mutual expectations are clearly put out straight from the start. Number 1 is about when should patients be involved, and they should be involved throughout the research project. And number 6 is about providing support for the patients. And 7 and 8 is about how to recognize patient involvement and make sure patients are thanked properly for their role in the research. So these may be very helpful if you want to involve patients in your research. In terms of facilitators and barriers, I want to discuss my own experience involving patient research partners in the development of patient-reported outcomes. And I found that one of the difficulties is the identification of patient research partners. We don't want the patients to be really representing a patient association, but rather bringing their own experiential knowledge. And then there are issues around language, shyness, and trust, and being able to speak up in a group. Then the patients have to participate in the working group meetings, and again, language may be an issue. I found that having a pre-meeting dedicated session for the patients is very helpful, so that they know what's expected and what will happen. Participation outside of face-to-face meetings is often more difficult if it's a long, drawn-out project, for example, over 2 years, I think that regular emails and newsletters can be very helpful because patients can lose motivation and interest, and also their disease may come in the way. And then recognition, as previously discussed, is an important issue. If we go beyond patient-reported outcomes, then it is more difficult, for example, to involve patients in a basic science project. But I think there are steps here where patients may be important, such as agenda setting, prioritization, funding and dissemination. I think we have to be very careful about the possibility of tokenism, where patients really end up being there just for the show. And within OMERACT, we have identified different facilitators, such as the commitment of the leadership, the individualized and self-organized reports, such as a glossary of medical terms, a pre-meeting information pack, specific sessions for the patients, and a strong patient network. And finally, an interactive and encouraging moderation style is very important to get patients to speak up during a meeting. In conclusion, I'd like to say that patient involvement in research is really a growing and also an exciting field, and rheumatology is very much at the forefront, with also research in cancer and HIV. There are really groundbreaking projects, in particular when it comes to patient priorities and patient-reported outcomes, whereas the place of patients in other research, and in particular basic and translational research, still needs to be determined, I believe. Facilitators have been quite well identified, and barriers need to be still further addressed. Thank you very much for your attention.